name's Luis Fernandez, and I'm a trauma and critical care and acute care surgeon here at Trinity Mother Frances Hospital. I'm a Brigadier General in the Texas State Guard, and I'm the Commanding General of the Texas State Guard Medical Brigade. We're part of the military forces in the state of Texas, which include the National Guard, and we serve the Governor and the President of the United States on disasters. Our area is disaster medicine expertise. All kinds of, whatever the Governor needs, whatever issues that our state needs, we're there to do it. After 9/11, volunteered to go to the Middle East, and I was too old for federal service at that time. And so I figured, well, there's something else I need to do, and I was fortunate enough that I got a phone call from Major General Timbo, who was at that time the commander of the Texas State Guard Medical Brigade, and he asked me to come on in and volunteer in that way. There's a significant need, and especially in a state like our state, which is a border state. It borders against Mexico, and they have significant issues there. Those transcend and come across our borders. We also have needs within our communities, and physicians are uniquely placed to provide skills and resources that other people may not. I believe it's important to volunteer your time, whether you do it in military or non-military, because there's a significant need out there. Medicine is a unique skill set. It's a tremendous commitment. It's a great privilege to serve and take care of people. And physicians have, I guess, the best well-rounded approach, particularly on the medical field area, obviously. And there's a significant need out there. And our state is one that, because of its location, geographic location, it abuts Mexico. There's all kinds of medical issues that impact our state. And I think that, I believe that we have a responsibility to at least make an effort to help to alleviate and mitigate against those issues.
My name is Jody Mackling, and I'm a pediatric nurse practitioner, and I work over at Broadway Commons. I spend most of my time volunteering with Crossroads Church in Canton. Well, basically one of the things that we do every summer, which I'm most involved with, is a mission trip over to Latvia, which is on the Baltic Sea near Russia. We go over there and spend about 2.5 to 3 weeks doing, the first half is a vacation Bible school for local kids in the area. Most of them are at-risk kids, low income. And then the second half we do a summer camp for local orphanages. Most of the kids come from outlying areas outside of Riga, where they don't get a lot of food or support from the country itself because they're in such small little towns. Well, I have a huge passion for kids. I'm also a foster parent and serve this area as a foster parent. And so for me, any way that I can help kids, whether it be in our area, other parts of our country, or across the world, I want to take every opportunity that's available to be able to help out. And my heart really goes out to kids that are orphans, and so being able to go over there and love on them for 2.5 weeks and play with them and provide them with a sense of security and love really, makes me full of joy. I think it's important to volunteer because everyone needs to give back, and I think that brings us all a sense of belonging to be able to give back to others that are less fortunate than us.
I'm James Rapaski. I'm a family practitioner in Kilgore. Have been with Trinity Mother Frances since 1996. Well, every 2 years, my wife and usually our daughter and son travel with us to eastern Bolivia and do medical mission work there.
When we arrive, we bring lots of donated medicine. We also buy some medicines down in Bolivia because things like amoxicillin are much cheaper when you buy them in Bolivia. And we take them to the mission. We advertise that the doctors are in. Our friends in the mission tell the people in the outlying areas that the doctors are there. And we spend our time in the clinic, which has been there for many years, and see patients.
I basically see babies all the way up through the elderly and take care of whatever their physical needs are at the present time. We also do a little bit of teaching with the natives, but basically we provide medical care. For me at least, it's medicine in its ideal form. It's refreshing also to be able to help those that have less than what we do, and not worry that they're going to feel guilty about accepting your help, and at the same time not worrying that you're going to need to be paid for it or something. It comes from the heart, and God is Father to all of us, no matter where we live, what we have, and it's an equalizer. Another reason that my wife and I have found it to be a great experience is that we've taken our children with us and let them experience a different culture, which is a whole lot different from what we have in the States. But the remarkable thing is the amount of time we spent together as a family. Here in the States, my wife's going one direction, I'm going another direction, daughter's going third direction, son's going fourth direction. But down there, we were all together every night, and we were able to spend time together, doing things together, praying together, playing games together. So it was a great family experience.
I like the idea that perhaps I can make their lives a little bit better, although I have been humbled over the years, realizing that the mebendazole I bring is probably more important in their health than my telling them that they have heart murmur or other things. But I also get a lot out of it. The people there appreciate our coming. The missionaries feel very lonely and very isolated, and this allows them to realize that there are people who appreciate what they are doing and bring them friendship and comfort. It's a very good way to understand the faith of other people. This is a very faith-filled community that we travel to, and certainly it's a reminder of the roots of our faith. It's for me, a revitalization of my faith every time I go.
I'm Dr. Jason Brockway. I'm a family practice physician at Kilgore Clinic, at the Trinity Clinic in Kilgore. And currently we work at the Alpine Clinic, which is an indigent clinic in Longview, my wife and I. When we went to Haiti, we went after the earthquake. It was the summer after the earthquake. And my wife and I were able to work through the Mission of Hope Haiti there just for a week. It was a short-term mission. It was a good experience though. Challenging conditions, very good organization to participate in.
We didn't really just want to go somewhere for a week and then we leave and there goes the care, but there was some continuity there. And so they asked us our strengths and we showed up, and there was a team of different other people. And so whoever was there that week was kind of the style of clinic they had. And there was also Haitian doctors still working there, so there wasn't just this big American effort and then, ooh, we're gone because we go back to the States. So we liked that there was still something left going on, following up with the people.
While I was there, I prescribed medicines for the wound care clinic and oversaw some of the treatments that were being done there. And then I worked in an outpatient clinic where people would come in for management of their chronic or acute medical conditions.
I had done wound care as a burn nurse. Issues from the earthquake, ongoing diabetic issues, injuries, other things that needed wound care. So that's what I had done specifically. In the other past things we've done, I like doing it just mainly because it's, to me, putting my faith into action. And I couldn't quote the verse, but Jesus said true religion is taking care of the widows and the orphans. And so getting to do it with my husband is a bonus. Then the other reason I'd say would be just an example to my kids of what we value and how to put that into everyday action.
The individual people that you help is great, and that is one of those things where you can reach out and touch somebody in another country, you can touch somebody in your same town. It gives me a bigger understanding of the world and of the needs that are out there.